Paramedic care for stroke. I'm going to briefly cover what you might expect if you have a paramedic crew arrive for someone having a stroke. When we arrive on scene, we're going to assess the patient. We're going to do some of the tests to determine their symptoms, and most likely we're going to want to get moving as soon as possible. There's a few things that we might do. We may give him some oxygen. We might start an IV on him, and we might ask a number of questions while we're on scene, but overall our goal is going to be the same as we had mentioned for the home care. Our main goal is just to get this patient moving to the hospital as soon as possible. We are going to make sure there's some things, if the patient does go unconscious, we're going to want to make sure that they don't throw up. We're going to make sure that they're breathing okay, that their heart rate's doing okay, and we're also going to check to make sure that they're not having any other problems. There's a few other things that we can check, but overall, if we do determine that it is a stroke that's causing these problems, we are going to just want to get this patient moving as quickly as possible. With the paramedic care, we're going to ensure, one of the things we want to make sure is that they don't eat or drink anything prior to going to the hospital. We want to make sure that they're able to swallow, and it's just standard practice. We don't want them to eat or drink anything prior to going in. Another part of care that we may consider en route to the hospital is there are certain actions that we may take depending on the doctor to control their blood pressure if their blood pressure becomes extremely high. The way that we work is we always have contact with a medical director who is a doctor at our local hospital, and based upon their advice, we may alter which care we give.